Hey y'all, my name is Mieklan Bortnick, and today we're going to talk about infectious diseases and how they make us sick. So let's dive right in. This is just an outline as to what is going to be contained in this presentation. We're going to talk about microorganisms, just the basic things about them, give you a little bit of background information. We'll talk about what makes things pathogenic, the transmission of pathogens, types of infection, ways hospitals are trying to protect and prevent those types of infections from happening, and then we'll conclude kind of going through each and every one of these topics that we've talked about today. So let's go back to the basics. What are microbes or microorganisms? Well, microbes or microorganisms are very small or even microscopic living things that can be single or multicellular. These living organisms cannot be seen with the naked eye, but we like to view them through a microscope. And in 1676, this man over here, Antoine van Leeuwenhoek, was credited with the discovery of microbes or microorganisms. And this picture right here to the right is a model of his original microscope. So we know that microscopic things can be viewed with a microscope. So on our body and in our body, we have those good germs, like there are good and bad germs. These are good germs, our normal flora or normal microbiota, which are bacteria that are permanently residing on our skin or inside of our body. Places like in our upper respiratory system, in our nasal cavity, all of that, sometimes in our gastrointestinal tract, or even in our urogenital tract. So how many microbes do you think are in a human body? Well, just to give you some background information, in our body we have 10 to the 13th power number of cells in our body. And to go even further from that, the number of microbes that we have is estimated to be about 10 to the 14th power, which is a lot. So we have those normal flora on our body, but we also have transient flora. These are bacteria that come from the environment and are only temporarily on our skin. These bacteria are easily able to be washed off with proper hand washing technique, and they can dry out and don't last long on our skin. Moving on, we'll talk about pathogens. So, what is a pathogen? A pathogen is a microorganism that is capable of causing disease to its host. So you say we're always covered with these microbes or microorganisms like our normal flora and our transient flora. Can those be pathogenic? The answer is yes. Normal flora is not always pathogenic. Normally it's not. But if that normal flora is in an area that is not typical to its environment, so like say we have E. coli in our intestines, if we are to ingest E. coli, we can get sick from that because that normal flora is not where it's supposed to be. Transient flora is more than likely going to be pathogenic, but like we said, since it is easily washed off or dries out on our skin, we don't normally catch pathogens from that. So a few ways that pathogens affect our body and our cells is through direct damage of replication. So bacteria to replicate are brought inside of our cells or brought inside of our body, and they go through the lytic or lysogenic cycles. And once they start to replicate, if they are phagocytized into a cell or eaten by a cell, they are able to multiply. And when they do multiply, they lyse the cell or they break the cell membrane and end up destroying the cell. So that's the direct damage through replication. Also, an excessive immune response. Our body is full of this amazing immune system filled with white blood cells and everything. And whenever we start to feel sick or our body notices something that is not right, those white blood cells attack and we end up swelling and having that response and having a fever. And if our body does too much of that immune response, sometimes it can actually harm our good cells that have not been infected with that pathogen. Let's move on to pathogenesis. So how do we come across these pathogens? How do they come into our body and how does the pathogen affect us? We'll start off with exposure. We are exposed to pathogens every day in the environment, coming into contact with other people. So being exposed and being in that environment is the first step. Adhesion. Our bacteria are little sticky suckers, and they are able to stick to our skin or stick to the upper respiratory tract and or any other tract in our body and cause us to become sick because they then invade our cells. Now, this invasion again is whenever we take in that bacteria into our cells, or we take in their DNA, and then we start to feel the effects of the replication that they have, that cell damage through the infection. That is when we're really sick, that stage. And then finally, the transmission from person to person or us to an object, which we'll talk about a little bit in the next slide with these infectious diseases. So, or these types of infections, I'm sorry. So different types of infections can be communicable diseases. These are diseases that are transmissible between individuals. So from person to person, a disease is traveling. Say, I give you the flu, you give me strep throat, something like that. There also are contagious diseases. So these contagious diseases are a type of communicable disease, but these are easily transmissible between individuals. Now, there are non-communicable diseases. These are diseases that can be contracted via contact with environmental reservoirs or animals, such as drinking contaminated water, or maybe eating an animal who was originally infected with a disease before they died and they are eaten and cooked or whatever. So then we'll go on to nosocomial infections. These are also known as hospital-acquired infections, and these diseases are, like they're said, acquired in a healthcare facility or a hospital. And to be considered nosocomial, like as an infection, it must be developed within 48 hours after admission to a facility like a hospital or a retirement home or a rehab facility. So let's move on and talk about some other types of infection. These go into more specific, like a nosocomial infection is an infection caught in a hospital. However, if you have a procedure done and you have an infection at the site of the procedure, it is called an iatrogenic disease or infection. So these surgeons to the right say wherever they're operating at the abdomen, on the leg, an infection that comes from that specific site, maybe from an unsterile instrument or someone who accidentally becomes unsterile while they're scrubbed in, can be considered an iatrogenic disease. We also have acute diseases, which, like their name, it means that they are short in duration. Chronic diseases, same thing, can last for years or months with that long duration period. And then we have latent diseases. These diseases may be in our body for many years without even knowing it because they are not actively replicating. So they lay dormant for all of that time that they're in our body. Next, we're going to talk about hospitals and their policies. So within a hospital, especially in the surgery department, there is this group of people who form these policies called the Joint Commission. Now, the Joint Commission has set out different policies on aseptic technique and clean technique. This picture over here kind of shows how the spread of C. diff, which is a pathogenic microbe, spreads, and it could have been prevented by using these aseptic or clean techniques. So let's go through a little bit about these aseptic and clean techniques. So we want to utilize our barriers. This is talking about having gloves and having gowns and having masks and having hair nets and being able to basically put up a barrier between you and your ports of entry, so like things like your nose, your mouth, your skin, and a pathogen. Same thing with clean techniques. However, aseptic will be sterile. Clean techniques will just involve, just gloves, like that actual protective barrier. It doesn't necessarily need to be sterile. The next thing we'll talk about is patient and equipment preparation. So in the operating room, using aseptic technique, they will use this aseptic cleanser on the skin wherever the incision sites will happen during the procedure. And then the equipment is always sterilized through an autoclave, which is a machine that heats up the instruments really hot to kill those germs or kill those bacteria that reside on them. And then will be processed and put into containers where they are then ready to be used for the next time. Clean technique, the same thing as like using certain type of solutions, so alcohol along the areas of like vaccines and other things like that. We'll move on to environmental controls in aseptic technique in the operating room. Make sure that the doors are staying closed, making sure that there's not a lot of hustle and bustle throughout the operating room, bringing in and out those unnecessary pathogens that could possibly be lying on people's clothes. There's also the positive pressure throughout the room in an operating room, the way that the air flows is straight down over the bed and then out through the doors. No air is coming in through the entries and exits of the operating room. And then clean technique, same thing, just keeping a limited amount of people in the room whenever you're trying to control the environment. And then contact guidelines. This is specific pretty much to aseptic technique, keeping that sterile to sterile contact. Say you're donned or clothed in a sterile gown and sterile gloves. You only want to touch things that are sterile, like a sterile drape that is placed over a patient whenever they are having a procedure, or a sterile cover for a table. And then clean techniques, using clean gloves, not touching something dirty, and then using it on a patient, stuff like that. So that's how C. diff in these pictures could have been prevented. So how can we combat these pathogens? Like we said in the last slide, how hospitals are being able to combat these pathogens by having these aseptic and clean techniques. We can wash our hands constantly. Anytime you touch something, before you eat, after you touch someone else, you sneeze or cough into your hands, wash them. We can also do PPE or personal protective equipment. These are things like wearing gloves, wearing gowns, keeping that area of your skin safe if you have any open wounds, wearing a mask, which is also a part of personal protective equipment, and then also taking our antibiotics for their duration. Our body uses those antibiotics in order to form our immune response to certain bacteria. So if we are not taking those antibiotics to help fight that bacteria that is currently in our body, the bacteria will be able to use that against us and be able to mutate and become more pathogenic, more able to infect us because we didn't use our antibiotics correctly. So in conclusion, there are microbes all around us. There are many types of microbes that can help and harm us, like our normal flora or transient flora. And then just being able to be aware of the transmission of microbes so that we are better able to protect ourselves from it. And then also different types of infection and where they come from. Thinking about, how did I get this disease? Was I in contact with somebody who had it? Did I drink something that could have possibly been contaminated? Things like that. So overall, being able to identify and connect with how to prepare yourself or how to protect yourself from these pathogens. And here are my references. Thank you so much for listening to my presentation.